Today, I'm talking all about the causes of bloody diarrhea. Are Nexgard and Bravecto safe, and what are the alternatives? I'm discussing itchy ears, the causes and the treatment of them. I'm discussing allergic reactions, what you should know, and also how to stop your dog from licking you. But first, let's cue the intro.
You're listening to the Dr. Alex Answers podcast, the show that answers all of your dog and cat health questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Hi and welcome to episode number 10 of the Dr. Alex Answers Show. I'm Dr. Alex, the veterinarian behind ourpetshealth.com, where my aim is to help you and your pet to live a healthier, happier life. Thanks for joining me on this episode. I've got some fantastic questions coming up, 3 of which are dealing with skin and the creepy crawlies that can cause a whole load of problems for our pets. But before we get into them, if we're meeting for the first time and you enjoy the show, then make sure you subscribe, and you can also get your question answered just by heading over to dralexanswers.com. Also, before we start, I'd just like to read you a kind review I've had from Alpine Annie, and she writes that she's a cat lover. I'm a person that is obsessed with my animals, and I love having a podcast to answer all my weirdo questions without having to go to the vet right away. Great host and excellent information. Well, thanks so much for that kind review. All weirdo questions are certainly welcome. And if you enjoy the show, I'd love it if you could leave me a review like Annie. Just head over to ourpetshealth.com/review. Thank you so much. And so my first question is from Jem, and she noticed that her dog had some diarrhea with blood that was first discovered in the morning, and she's just wondering what the causes are and kind of what the treatment is. So kind of start off with what the causes of diarrhea with blood in. Now, a simple colitis is most common, so that's an inflammation of the lower intestinal tract, so not up by the stomach, but lower down. And that's the most common kind of cause of diarrhea with a little bit of blood. So that'll typically be kind of blood flecks rather than a stool that is completely blood. There may also, and there's very often also, some mucus present in that stool, and simple colitis also often causes straining. So it might be that your dog is straining and seems to want to go to the toilet, but actually very little is being produced, and that's a normal sign of colitis as well. But there are other causes of bloody diarrhea in dogs, and some of those include hemorrhagic gastroenteritis. Now, that is a condition that comes on very, very suddenly. More often than not, it comes on very suddenly. It's thought that it's due to maybe a clostridial infection, although that's not always the case. So that's a certain type of bacteria. But you've got a diarrhea that is just incredibly bloody. So it almost looks like complete blood sometimes, and that can cause dogs to become unwell very, very quickly. They get very dehydrated, and they definitely need treatment at the hospital or the vet clinic for that. You can also get infections such as parvovirus, which is clearly a very serious infection and one of the main diseases that we vaccinate our dogs against. We can get bloody diarrhea due to parasites, so different types of parasite within the gut, so worms and that kind of thing. You can have an intestinal foreign body, so a dog who's eaten something and it's working its way down, causing irritation and ulceration of the lower intestines, or even getting obstructed. Now, by the time it gets down to the lower intestines and when we would expect to be seeing kind of blood, often it will pass because it's already got through the most narrow bits. If something is getting stuck higher up in the intestines, so in the small intestines or even in the stomach, if that's causing bleeding, then actually what will happen is we'll see kind of a dark tarry stool because the blood that's being produced and leaking into the intestines is getting digested, and that causes a dark kind of black tarry stool. Other causes of bloody diarrhea, though, can be tumours of the colon, so they can be bleeding, and that tumours can also be interrupting the normal absorption and digestion of the food within the intestines. And then another thing that can sometimes cause what we think is maybe a bit of blood on the stool is actually a ruptured anal gland abscess. So the anal glands are 2 sacs that normally express either side of the anus. If they become infected and enlarged, then they can burst out through the skin, which can cause quite a bloody pussy discharge. And if that's coating the stool, then you might think that your dog has got bloody diarrhea, but actually they've got an anal gland abscess. So those are kind of the most common causes of diarrhea with blood in them in dogs. Really, what's the treatment then? Well, If we're dealing with a simple colitis, which is, like I said earlier, by far and away the most common thing, then, and if a dog is otherwise well, if they're eating, if they're drinking, if there's no vomiting, if they're bright and active, then really a bland diet and monitoring are really likely to be sufficient. I actually discussed in the last episode of the Dr. Alex Answers show all about the different feeding options for a dog with colitis, so definitely go back to that episode, the last one, and check out that answer there. But if your dog has bloody diarrhea, if they're unwell, if there's lots of blood within the stool, so not if it's just a kind of a little bit of a flecking, a small amount of blood, but if it's completely kind of covered in blood and there's blood throughout the stool, then it's definitely best to get checked out by your vet just to check that there's no other treatment, be that antibiotics, be that intravenous fluids, be that other investigations, x-rays and that kind of thing that needs doing. So I hope that helps if you ever have a dog with bloody diarrhea.
You're listening to the Dr. Alex Answers Show.
And my next question is from Renee, who asks, given the warning in September of 2018 by the FDA regarding Nexgard and other drugs in that class, which indicate potential negative side effects, which product would you recommend for her dog Bella, who also has syringomyelia? So let's start off with the fact that the FDA released a memo about the isoxazoline class of drugs, and that includes products like Nexgard, but also Bravecto, Simparica, and Credelio. They fall all under that isoxazoline class of drug. These drugs are used to treat and prevent flea infestations and also to kill ticks. And when they were first released, the recognised side effects really were diarrhea, vomiting, drooling, and inappetence. But over time, it's become apparent that there are very rare instances of muscle tremors, wobbliness, and even seizures in dogs taking these drugs. The incidence, though, is very, very low. So it's important not to over-exaggerate that. But it doesn't always include dogs that had a previous history of seizures. So if a dog who's had seizures before, you might expect them to be more affected. But actually, some dogs have had seizures who haven't had a history of that in their past. So, I think potentially we shouldn't be using these classes of drug in dogs with epilepsy. And probably it's a good idea to be cautious if there is a history of seizures or if there's felt to be a high risk of a dog developing seizures, over and above what that normal risk would be. Now, this FDA alert was really to further publicize the potential risks of these drugs rather than reporting a previously unknown potential side effects. So it's been known that these classes of drugs can cause neurological signs, but really they are still considered safe and they're still considered an effective treatment because the risk of this is very, very low. Any drug that we give, and I've said this kind of time and again, any drug that we give that's actually doing something has the potential to cause side effects. We shouldn't lose focus of the fact of why we're giving these drugs in the first place. That said, there are plenty of other flea prevention and treatment products out there that are very effective. They will all come with their own risk of side effects though as well. Much like these isoxazoline drugs, though, the risk is very, very small. There are also several other tick products, although in my mind, really, the only one that is just about as effective as this class of drug is the Seresto collar. So there are other drugs that are licensed for to kill ticks and to prevent ticks from biting and feeding, but really, in my experience, they're not nearly as effective or as rapid in their ability to kill ticks as either the Seresto collar, so long as that's applied properly and it's renewed when it needs to be renewed, or the isoxazolines. I think they've kind of been revolutionary in our ability to prevent tick bites, to kill ticks much more rapidly and much more effectively and reliably, and so prevent tick-borne disease. Now, the best product to use for any individual dog, it really depends on the local risk of parasites and the diseases that are that they can potentially carry, which are present in some areas but not others, and that's something that I'm actually going to kind of come to in a later question in today's episode. And if you're wondering about ticks in particular, for a rundown of ticks, especially in relation to Lyme's disease, then I'll make sure I add a link in the show notes to one of my previous articles that discusses all about this. But the bottom line is that Nexgard, Bravecto, Simparica, they are very effective drugs. They do a very good job of both preventing flea infestations, treating flea infestations, and killing ticks, and they do a much better job than the vast majority of other tick products out there. And although there is a risk of developing tremors and even seizures, this risk is very, very, very low. So it's something like less than 1 in 10,000 dogs will experience this, and it's likely to be much lower. So, while we need to bear all of these things in mind, and if your dog is epileptic, we should definitely be cautious, but we don't want to over exaggerate the risks when there are potential benefits and when we're using them to treat or to prevent diseases like Lyme's disease, which are potentially fatal. Okay, so before we move on, I just wanted to let you know that this podcast episode is brought to you by the ourpetshealth.com guide to raw feeding. So this is my free ebook that goes through all of the risks and benefits of raw feeding compared to kibble. If you just head over to dralexanswers.com and sign up for the free download resource center, then you'll get access to this free ebook as well as all of my other guides, calculators and downloads, all designed to help you and your pet to live a healthier, happier life. Right, so the next question is sent in by Maisie, who writes that 6 months ago, their dog started to scratch her right ear constantly, noticed a tarry build-up, it was cleaning the ears with a natural product, but the dog was still scratching, the wax was still building up, and at a vet check, the vet said it wasn't infected, but to keep the ear hairs trimmed and not to pull the hairs out. But still, months later, the dog's still scratching constantly, and sometimes even when the ears are being touched, the dog is yelping. They do have a slight smell, but the ears aren't particularly red to look at. But, what could be going on and what could be done about it? Well, we need to first think about why the dog is scratching and getting a wax build-up. And there can be a number of causes of itching, and that can include parasites to start with. So that could be fleas, but it could also be mites, so ear mites in particular. We could get allergic skin disease. So again, that can be a flea allergic dermatitis, so an allergy to fleas. It can be an allergy to pollens and other things within the environment, which is something that we call atopy. And we can also get a food allergy that causes itchy skin. And then we can also get local ear problems. So that can be just ears that have had chronic long-term infection that's caused a narrowing of the actual ear canals, which makes kind of subsequent infections more likely. Hairy ears can certainly increase the risk of infection. The kind of big flappy ears, so like spaniels have, water in the ears as well. So dog who likes swimming, and also any masses as well. If there's a mass within the ear canal, then that can make infections more and irritations much more likely. So when we're thinking about kind of treating itchy ears or ear disease in general, we need to address the underlying causes. So it shouldn't simply be a case of popping ear medication down there and leaving it at that, doing nothing else, especially if we've got a repeat problem, something that keeps flaring up or is poorly controlled with that initial treatment. So, because as I already said, long-term ear inflammation can cause scarring, which makes future problems more likely. And we also need to address the underlying cause, because at the end of the day, being itchy all the time is absolutely miserable for a dog. I liken it to being in pain all the time, being in constant pain. Being itchy has the same effect on quality of life. It's just miserable. So there's a number of things we can do to try and diagnose the problem. So we can take samples from within the ear. We can do ear smears, looking at whether there's yeast or bacterial infection, whether there is any resistant infection, so we can send off for culture and sensitivity as well, take a swab and send that off to the lab. We might also want to be taking x-rays to look at the middle ear if we suspect that there is a middle ear infection or a mass in the middle ear that's underlying all of these problems. We might want to do a trial treatment, so give an anti-allergy medication, for example, something like Apoquel. We might want to do a diet trial, so change to a skin diet or an exclusion diet to try and rule out a food allergy. And then, once we've done all of those, treatment really is going to depend on the underlying cause and controlling this if at all possible. So we might be using a cleaner to help mobilize wax and create an environment that doesn't favor the growth of bugs. And there are some great cleaners out there that do just that. They're not antibiotics, but they're antibacterial. They dry the ear and they help reduce the buildup of debris within the ear and provide an environment that isn't favorable for the bacteria or for the yeast to grow in. When we're cleaning the ears as well, we don't want to actually poke a Q-tip or a cotton bud down the ear to clean them, because that can just push the wax deeper and compact it down, making the problem much worse. We want to be using the cleaner to mobilize that wax, and then we just want to be taking a cloth or tissue and wiping the outside surface of the canal that we can see, so just removing the wax and debris that way. And then something to mention, and I say to the vast majority of my clients who have pets with skin problems, is that skin conditions, and that includes ear disease, they can be incredibly frustrating, and they can take some time to settle and to decide on the best treatment and prevention strategy for each individual. So it's often a case of working through a little bit of a process, seeing what works, seeing what the pet doesn't seem to respond to, and coming up with a tailored individual treatment plan. So it's not a one-size-fits-all strategy that will be appropriate for every individual dog, but yeah, we need to be thinking about tackling any infection that's present, addressing any underlying causes, and then managing the condition ongoing.
Ask your question at dralexanswers.com.
Melissa writes in with the next question, and she says that she went to the vet with her puppy who received a dose of Revolution for fleas, and after that his scratching actually got worse. He got bumps on his stomach and ears. She didn't know what to do to stop this reaction, or could it be something else? She applied cortisone to try and calm his itching, but what's the cause, and what can we do to treat this, to prevent these, or to treat these lumps and to treat the itching that the little puppy has developed? So we'll start off by saying that Revolution, it contains the active ingredient called selamectin, and it's primarily used to treat and prevent flea infestations, although it's also active against some other parasites as well. And like kind of any drug, as I have already discussed in the previous question about the isoxazoline class of drugs, any drug there is a small risk of side effects. And it really does sound like this puppy has had an allergic reaction to the Revolution that's caused itchiness and hives. Of course, it could be actually that the dog was also stung by a bee or had an insect bite or something at a very similar time, and that's caused the reaction. So we can't say for certain that it was the Revolution, although I'm not a big fan of coincidences, and that would have to be up there in the concerns. Now, while an allergic reaction is a possibility, there are other potential side effects to selamectin, and that includes going off food, drooling, vomiting, diarrhea. You can even get laboured breathing, twitching, and even seizures if we're having an allergic reaction to any kind of product or any insect bite or anything like that. These side effects, they really are considered very rare though, and generally affecting less than 1 in 10,000 animals. So, it's not very common. Treatment of an allergy, it really depends on how severe it is, and that can include a number of different things. It can include antihistamines, so that can be antihistamine tablets, steroids, so that can be injection, it can be tablets, it can also be creams, or if we're having a severe allergic reaction, then adrenaline is going to be the thing to give. So just like with people who have peanut allergies, for example, they'll carry an EpiPen around, and that contains adrenaline, which is for the treatment of severe reactions. So in the same way, if we've got a dog or a cat who's having a severe allergic reaction, then adrenaline may be something that we need, although it's very, very rare that that's the case. And, the best treatment is going to be based on an examination of the patient by the vet to see what works best. Also, if we know that a dog has had allergies, so if we're talking about something like to a bee sting and they just get a little bit of itchiness and a bit of hives, then, it would be appropriate to have, some treatment on hand to give that without needing to necessarily consult with your vet, providing that was doing the job and not making things and things weren't getting worse despite giving that treatment. Now, what do we do with this puppy? Well, I think that's based on the vet's examination. It doesn't sound like it was a severe enough reaction to need any kind of more serious intervention, any injections, but there are a number of things that can be given. We also want to avoid this happening in the future, obviously. So, it might be a good idea to avoid this class of drug in future in this specific puppy. Talk to your vet about which products are appropriate, which other products are appropriate. And that's really going to depend on where you are in the world, depend on which parasites are present in your local area, and what the disease risk is for diseases that are carried by parasites. So different parasites can be fleas, it can be ticks, it can be sandflies, and diseases can be things like heartworm, leishmania, Lyme's disease. So there's a number of different things to consider, and depending on all of those risks depends really on what the best class and the best product to use in your specific individual dog, in your specific individual area. And just remember that the information that I give in these podcasts is not a substitute for a consultation and examination with your pet's veterinarian, and should not be taken as specific advice for any individual pet. If your pet is unwell, if they're injured, or if they're suffering from any kind of problem, then talking to your vet is always the best course of action. And then I'm finishing up today with a question from Kate, who asks, how can I train my dog not to lick people's feet? So, dogs who are licking people, if your dog is licking you, it's really not an uncommon situation and it's not an uncommon problem. And there's a number of different reasons that we might want to stop that. It might be annoying. It's also potentially unhygienic, depending on where they're licking you. But with any behavior, there are things that we can do to take steps to stop this. So we can definitely stop your dog from licking you. And I'll start off by saying that consistency is key. So whenever we're doing any form of kind of training, any behavioral management, then it's important that not only are you consistent with your dog, but that everyone in the house is consistent and everyone that your dog comes across is consistent. So if your dog is licking you and you manage to take some steps to prevent that, but your partner or your children are letting your dog lick them quite happily, then really you're giving your dog mixed messages and setting it up for failure. Really, your dog's just going to be confused and it's not going to do what you want, which is going to be frustrating for you. So consistency is key. Everyone needs to do the same thing. And the first step to take, or the first thing to try, would be just to ignore your dog. So this way, if you completely ignore your dog, if your dog's licking your feet in this case, but if they're licking your hand, if they're licking your face, if you just completely ignore them, kind of cross your arms, don't look at them, don't talk to them, then the dog will learn that the behavior doesn't result in attention. And then conversely, if your dog stops and sits down, or your dog is doing something else, then you want to reward the good behavior that your dog is showing. So ignore your dog completely while they're licking you. The moment they stop and do something else, maybe that sit down, be that lie down next to you, then you jump in and you reward them. You give them your attention. You maybe give them treats, so that you're rewarding the good behavior and ignoring the behavior that you don't want to happen. If that's not working, then we want to just not allow it. So the moment that your dog starts licking you, you get up, you walk away, you go into another room. And again, in a similar way, your dog will learn that the fun and the interaction stops as soon as it does that behavior. So much the same way with puppy biting, we say, ow, we withdraw our hands, we maybe take ourselves out of the room. The puppy learns that if they bite, then the fun stops. The same thing here. If the dog licks, the fun stops, and that will soon teach them that that's not something that they want to be doing, and it's not in their interest. We also want to potentially be distracting your dog, so give it something to do. So a lot of our dogs can be quite bored, and this might be just a sign and expression of their boredom. They're trying to pester you because they're wanting some attention, they're wanting something to do. So give your dog something to do. So that could also be something else to lick. So that could be something like a licky pad. It could be a Kong. There are various kind of slow feeder treat bowls, snuffle mats. There's lots of different things we can use to keep our dogs interested, to give them some mental stimulation and to keep them active. Also, we want to make sure that we're exercising, that we're giving other forms of stimulation. We're taking them out for runs. We're throwing a ball for them, that kind of thing, just so that they have an outlet for their energy. So they've not just got lots of pent up frustrated energy, and that's causing them to pester you as well. And then, if despite ignoring them, despite getting up and leaving the room, despite giving your dog other things to do, and you're still really struggling, then something else to think about would be using something like a bitter apple spray, in this case on your feet. So that's something that you just would pop on there. It's something that tastes disgusting, so your dog will lick it and they won't like it. It's not harmful or anything, but it's just something that that they don't find appealing. Be warned though, if all you're doing is using something like this, then the licking is just going to move elsewhere, so they'll start licking somewhere else, or another problem behavior is going to develop. So if we're using something like a bitter apple spray, we need to be taking other behavioral modification steps that I've already discussed to stop that problem behavior. If you're still struggling, then you want to be getting in touch with a dog trainer, with a behaviorist, to try and set up some specific interventions and specific strategies for your dog, that would need to be kind of very much individualized to make a treatment plan. But by and large, those few strategies should do the job for most dogs and stop them licking you. Okay, so that's it for this episode of the podcast. If you've enjoyed it, make sure you're subscribed so you don't miss out on future episodes. And remember to head over to dralexanswers.com, where you'll find all the links and downloads mentioned in today, as well as find a form that you can fill in to ask your own question to be featured on a show very soon. But until next time, I'm Dr. Alex. Take care.
You've been listening to the Dr. Alex Answers podcast. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show where you ask the questions and Dr. Alex answers.